If you feel lightheaded, the goal is simple. Stay safe, stop it from getting worse, and figure out the most likely cause fast. In the next 5 minutes, you can often reduce symptoms with a few low-risk steps. First, treat this like a balance problem, not a toughness test. Sit down right away, or lie down if you feel like you might faint. If you're standing, widen your stance and hold something stable while you move. Next, slow your breathing, because anxiety can amplify the sensation even when the trigger is physical. Then, do a quick check. Are you overheated, dehydrated, hungry, or did you stand up too quickly? Those are common and fixable. If you have chest pain, severe shortness of breath, one-sided weakness, confusion, or you actually faint, skip the tips and get urgent help. For everyone else, let's walk through a calm, step-by-step reset you can use almost anywhere. Moving to slide 2. Step 1 is positioning, because blood flow and balance are the fastest levers you can pull. If you can, lie on your back and elevate your legs on a chair, couch arm, or a pillow. This can help if the lightheadedness is from blood pooling in your legs after standing, dehydration, or a sudden drop in blood pressure. If lying down isn't possible, sit and lean forward with your head slightly down, elbows on knees, and keep your feet flat. Avoid bending your neck sharply if that makes you worse. Loosen anything tight around your waist or neck, like a belt or collar. If you're in a hot space, move to cooler air. Give this position at least 1 full minute before you judge if it's working. Many people pop up too quickly, and that can restart the cycle. Your job is to create stability first, then troubleshoot. Moving to slide 3. Now do a fast, practical symptom check. Lightheadedness can mean different things, and the fix depends on which one you have. If it feels like the room is spinning, that's closer to vertigo. If it feels like you might black out, that's closer to faintness from blood pressure or blood sugar shifts. If it's more like floating, tingling, or a sense you can't get a full breath, anxiety or overbreathing may be contributing. Ask yourself 3 quick questions. Did this start right after standing up? Have you had much to drink or eat in the last few hours? Are you hot, sweaty, or coming off intense activity? You're not trying to diagnose yourself. You're just picking the most likely lane so you can choose the safest next step. Keep your movements slow while you sort it out. Moving to slide 4. If you suspect dehydration or heat, do a small, steady rehydration reset. Take several small sips of water over 1 to 2 minutes. If you've been sweating, a drink with electrolytes can help more than plain water, because sodium helps your body hold on to fluid. If you don't have an electrolyte drink, a salty snack with water can be a reasonable substitute for many people. Avoid chugging a large amount quickly, which can upset your stomach and doesn't speed absorption much. If you're overheated, cool your skin, move to shade, loosen layers, and place a cool cloth on your forehead or the back of your neck. Keep sitting or lying while you do this.
Dehydration-related lightheadedness often improves gradually, not instantly,
so look for small signs: less wobble, clearer vision, steadier breathing. Moving to slide 5. If the lightheadedness might be from low blood sugar, the fastest safe move is a small amount of quick carbohydrate. Think juice, regular soda, glucose tablets, honey, or a few candies. Something that absorbs quickly. A common approach is about 15 grams of fast carbs, then wait 10 to 15 minutes and reassess. If you have diabetes or you're unsure, be cautious and follow your personal care plan if you have one. After the quick carb, a small snack with protein or fat can help keep you steady, like yogurt, nuts, or peanut butter. But don't force food if you feel nauseated. Also, notice context. If this happens repeatedly when you delay meals, that pattern matters. The goal here is stability, not a sugar spike. If symptoms are severe, worsening, or you can't keep anything down, get help. Moving to slide 6. A very common trigger is orthostatic lightheadedness, feeling faint after standing up because blood pressure doesn't adjust fast enough. If that sounds like you, don't stand still. Instead, use your leg muscles like a pump. While seated, do strong ankle pumps, then tighten and release your calves and thighs for 30 to 45 seconds. If you're standing and safe, cross your legs and squeeze, or do a gentle march in place while holding on to something stable. These maneuvers can push blood back toward your core and brain. Then stand up in stages, From lying to sitting, pause. From sitting to standing, pause again. If you're dehydrated, combine this with small sips of fluid. If orthostatic symptoms are frequent, that's worth discussing with a clinician, especially if you're on blood pressure medications, without changing anything on your own. Moving to slide 7. Sometimes the lightheaded feeling is driven or amplified by overbreathing, especially during stress, pain, or a panic surge. When you breathe too fast, carbon dioxide drops, and that can cause tingling, tight chest sensations, and a floaty head. The fix is not big, deep breaths. It's slower, smaller breaths. Try this for 1 minute. Inhale gently through your nose for 4 seconds, then exhale for 6 seconds. Keep your shoulders relaxed and your jaw unclenched. If counting stresses you out, just make the exhale longer than the inhale. You can also place a hand on your belly and aim for the hand to rise slightly, which encourages calmer breathing mechanics. If you feel worse, stop and return to normal breathing. The goal is to signal safety to your nervous system, not to force control.
Moving to slide 8. If you're dealing with spinning or motion-triggered dizziness, keep the approach gentle. Sudden head turns can make vertigo feel worse. Pick one stable head position and hold it for 30 to 60 seconds. Fix your gaze on a single point if that helps you feel anchored. If nausea is building, stay seated and keep your head slightly elevated rather than fully flat. Some people get relief by lying on their side with the spinning ear upward, but it varies. What matters is minimizing rapid movement while your inner ear settles. If you know you have benign positional vertigo, specific maneuvers like the Epley can help, but they're best learned properly first, because doing them wrong can worsen symptoms. If vertigo is new, intense, or comes with hearing loss, severe headache, weakness, or trouble speaking, treat it as urgent. Moving to slide 9, let's do a quick safety screen, because some causes of lightheadedness are not waited-out situations. Get urgent medical help if you have chest pressure, pain spreading to the arm or jaw, severe shortness of breath, or a new irregular heartbeat sensation. Also treat it as urgent if you have one-sided weakness, facial droop, trouble speaking, sudden confusion, or the worst headache of your life. If you faint, hit your head, or you're pregnant with significant dizziness, get checked. Ongoing vomiting, black or bloody stools, or signs of severe dehydration, like not urinating, also matter. These aren't meant to scare you. They're meant to protect you from missing the rare but serious stuff. If none of these apply, you can usually continue with the calm reset steps and monitor for improvement over the next 10 to 30 minutes. Moving to slide 10. After you feel steadier, the next goal is preventing a rebound. The biggest mistake is standing up fast and going right back to the trigger. Take 2 minutes to re-enter normal activity. First, sit upright and do a quick body scan. Vision clear, breathing calm, legs steady. Then stand near support and wait 10 seconds before walking. If heat or exertion caused this, reduce intensity and cool down longer than you think you need. If dehydration was likely, keep sipping fluids over the next hour rather than trying to fix it all at once. If skipping meals was the pattern, plan a simple snack you can keep on hand. And if this happens repeatedly, write down 3 details: what you were doing, when you last ate or drank, and how long it lasted. That information is surprisingly useful for a clinician. Moving to slide 11. Now let's talk about the most common why in plain language, so you can make smarter choices next time. Lightheadedness often comes from one of 4 buckets: not enough fluid, not enough fuel, blood pressure shifting too fast, or a nervous system stress response. Sometimes it's medication side effects, anemia, infections, heart rhythm issues, or inner ear problems. That's why patterns matter more than a single episode. If it happens after standing, think blood pressure adjustment. If it happens after exercise or heat, think fluid and electrolytes. If it happens when you delay meals, think blood sugar stability. If it happens during worry, crowds, or pain, think breathing and adrenaline. You don't need to label it perfectly. You just need a reasonable first guess and a safe response. And if your episodes are frequent, new, or worsening, that's the moment to get evaluated. Moving to slide 12. Here's a simple 5-minute protocol you can remember. Minute 1. Sit or lie down, legs up if possible, and loosen tight clothing. Minute 2.
slow breathing, longer exhale, and check for heat. Minute 3. Take small sips of water and add electrolytes if you've been sweating. Minute 4. If you suspect low blood sugar, use a small quick carb option and wait. Minute 5. Do leg pumps, then stand in stages only if you feel stable. If at any point you get red flag symptoms, you switch from self-care to urgent care. Keep it boring and repeatable. The best quick fix is the one you can do safely when you're not thinking clearly. If you want, save this as your personal checklist and practice it once when you feel fine, so it's automatic when you need it. Moving to slide 13. To wrap up, lightheadedness is common, but it deserves respect. Your first job is preventing a fall. Your second job is choosing the most likely cause: heat and dehydration, low blood sugar, blood pressure shifts, or stress breathing, and using a low-risk step that matches it. If you want one rule, it's this: stabilize first, then troubleshoot. If this video helped, subscribe for more calm, practical health explanations. And I'm curious, when you get lightheaded, which helps you more? A. Water and electrolytes, or B. Slow breathing? Share A or B in the comments. This information is not a substitute for medical advice.